Aloha mai kako. Our group project is on long-term care in Hawaii. Allow me to introduce my group members Shanella Kane, Lucy Miller, and Saini Su'e, who you'll be hearing from shortly. My name is Tani Kagesa, getting us started with our problem framing. It's been widely proven that a silver tsunami is coming. This is an exponential increase in the elderly population, which may be due to the baby boomer generation aging, as well as our elderly population living longer. This increase in the kupuna population will inevitably increase the demand for quality long-term care. About 70% of people 65 years and older can expect to use some form of long-term care. In Hawaii, there are almost 13,000 residents living in various long-term care facilities, and this does not include elderly living at home, aging in place, and receiving long-term care services in home. Unfortunately, quality care can be very expensive, and elderly living on fixed incomes cannot afford it. Long-term care insurance was created to help with this increased expense later in life. However, people who can afford to contribute to long-term care insurance plans are often in the higher socioeconomic status bracket. Depending on the level of care that our kupuna needs will determine their long-term care costs. Long-term care community placements can range from about $58,000 to $165,000 a year in Hawaii. As you can see, long-term care is very expensive. Services that might be more affordable or subsidized by the government often lack adequate regulation and the quality of care that our elderly need to thrive and survive. There are limitations to what are covered by Medicare and by Medicaid, and often there are discrepancies between what our kupuna might qualify for insurance to cover versus what services and equipment they actually need to be safe and have quality of life. When we have this lack of affordable quality long-term care in Hawaii, it puts our kupuna in dangerous and desperate situations where they're at higher risks for elder abuse, for their rights to be infringed upon. When their needs aren't being met, it can lead to unsafe and frankly dangerous situations. There's been a recent increase in kupuna dumping, which is when a family member or a foster home who can no longer care for an elderly's needs, they might take them to the emergency room and leave them there because they can't take care of them well anymore. All in all, this leads to a decline in quality of life, and this is due to the problem of a lack of affordable quality long-term care in Hawaii that we desperately need a solution to fix. I'm going to hand it off to Chanel, who will take us into the cost and burden of this issue.
As Tani mentioned, the phenomena of the silver tsunami pressures our kupuna and their families in a quick demand to find quality long-term care. I would like to briefly draw a picture for us the problems that the policies we analyzed are targeting. Some of the burdens families are faced with are having to care for their children and parents. Some work full-time jobs, so when their parents' health declines to where they need around-the-clock care, this leads them to scramble to find affordable, quality, long-term care options. Different levels of care mean different costs. This chart reflects the different levels of care, costs, and services provided. The families must quickly learn to navigate systems and find adequate financial coverage. I took the approach of interviewing to gather this information and found that our pathways to finding care were impressive. The women I spoke with were very patient, understanding, to the point, and knowledgeable. They each help with finding placement and completing paperwork. Now Sai is going to share with you the 3 policies we researched to address these issues.
So for our policy analysis project, our group identified 3 policies that are related to the social problem that our group is addressing. The first policy is Senate Bill 2337. SB 2337 is the Hawaii Long-Term Care Ombudsman Bill. This bill crossed over, but the legislative session went into recess due to COVID-19. If passed, this bill will increase the number of ombudsmen working out of the Executive Office on Aging to help with investigating long-term care facility complaints like kupuna abuse, neglect, and discrimination. Overall, Senate Bill 2337 will help protect the kupuna's health, safety, welfare, and rights, thus improving the quality of Hawaii's long-term care facilities. The second policy is the ACA, or Affordable Care Act, also known as Obamacare. The ACA is a healthcare reform signed into law by President Obama to extend healthcare insurance to millions of uninsured Americans. However, when President Trump got elected, he started to undo or repeal the ACA by signing an executive order instructing all federal agencies to minimize unwarranted economic and regulatory burdens of the ACA. As a result, it creates systematic barriers that are causing a number of changes for long-term care. For example, the repealment of the ACA will make it hard for states to use federal Medicaid dollars for long-term care support systems and services. Overall, ACA help provides affordable long-term care in Hawaii. The final policy is the CDC, or Center for Disease Control and Prevention, COVID-19 guidelines for long-term care facilities. The CDC guidelines provide a number of strategies to keep the kupuna safe from COVID-19. For example, educating residents, healthcare personnel, and visitors about precautions and actions they can take to protect themselves. It also addresses asymptomatic and symptomatic transmission by implementing a source of control for everyone entering a long-term care facility, regardless of symptoms. Overall, the CDC COVID-19 policy will improve the quality of Hawaii long-term care. For the next part of our presentation, Lucy will go over our policy analysis.
Policy analysis addresses measures on both the state and federal level. The state is responsible for certifying both short and long-term care facilities. Avenues to address the complaint include the Long-Term Care Ombudsman Program and the Residential and Family Council to assist in mediation with the care facility. The current LTC Ombudsman bill would increase the single full-time position from 1 to 6, assisting in the estimated 1,700 facilities statewide. The Centers for Medicare and Medicaid Services, CMS, provide rules and regulations for those eligible for Medicare and Medicaid services and rights through the ACA and all health insurance providers who contract with Medicare and Medicaid. Staffing is regulated on both a state and federal as well. Routine hiring of staff includes background checks, fingerprinting, drug screening, and specialty licensure, such as RNs and LPNs. The Nursing Home Quality of Resident Care Score also considers the number and type of specialty levels of staff. Here we have a snapshot of the 5-star Quality of Resident Care Score established through the CMS for 42 home care facilities in the state of Hawaii. Noting 3 islands do not have any 5-star CMS-rated facilities, and a vast majority of facilities are located on Oahu. And this leaves a large gap of care for our kupuna on the outer island. Due to COVID-19, routine non-emergency inspections have been suspended, but a special inspection of care homes will occur, prioritizing with a history for those with violations. The score overviews health inspections, staffing, quality of resident care measures, fire inspections, and penalties. Here is Chanel to wrap up our conclusion and discuss implications moving forward.
To recap, issues kupuna and their families face are establishing and maintaining in a seamless way quality and affordable long-term care. The Ombudsman Bill will expand their staff to oversee the quality of long-term care facilities responsible for resolving complaints, providing our kupuna with accessing quality care. The ACA provides financial assistance for care, although limitations are the complexity of navigating Medicare and Medicaid benefits, and if families aren't educated on the process, for example, the issue of having too much in assets, they may not qualify and spend down their kupuna savings. The CDC makes available a preparedness packet for long-term facilities. Although PPE equipment is limited, there are no mandatory requirements, meaning each facility implements their own policies and procedures, leaving some facilities lacking in quality and keeping the kupuna safe. Implications are creating more positions so facilities are accountable in upholding regulations and providing quality care. Provide families with a seamless pathway to financial assistance, and being prepared with mandatory guidelines and sufficient equipment in case of crises. Hope you enjoyed our presentation. Thanks for listening, and we are open to questions and suggestions.